I don't just have to help out in the kitchen or something like that. I can actually use something that I've learned to educate the people in my community. I can kind of give back in a unique way. We'll go do the flu shots, but we'll also do diabetes education for the patients. We'll test their sugars while they're there, and we'll actually catch that a lot of them have very high sugars, and then we can give them the proper resources and point them in the right directions to get screened and get checked, which otherwise they may not even have known that they were vulnerable or somebody who should be screened.
Says, yeah, anytime she says she needs a medication or something, Jora always helps her out. So when they go to a pharmacy, there's a bit of a barrier there, right? And here, they feel so comfortable just approaching him.
Not just in the Sikh community, we try to go the extra distance or do the extra thing, but even patients that we collaborate for with the clinic, we try to do the extra thing, you could say, including sometimes where I've gone and done shots for the patient at their home because they're just not able to come into the pharmacy.
My wife was bedridden and she couldn't, she needed her a flu and COVID shot. And he came to the house to do that. So that was I found that very, out of the way, for a person to do that. So he did that.
They're just not able to come into the pharmacy or put on different kind of diabetic supplies or sensors or something like that.
I think he's sort of a caring person. He seems to go to a lot of trouble to make sure that everything's okay. If things are not right, and sometimes they're not, he always makes sure they are.
I really like working with the doctors here and figuring out a little bit more of complex patient care.
If there's any questions, the two of them work together and keep my health going as it should.
He caters to all my needs and my wife's needs.
We collaborated with not just the physician, but also a nurse as well. A patient was a regular blister pack patient of ours. Unfortunately, she developed cancer, and then it was a lot of in and out of the hospital, a lot of different prescribers, giving medications. So we kind of set her up with our nurse who would go in, check up on her daily, bring the feedback to the pharmacy, and we would take that and collaborate with the physician on what the best plan forward would be.
Jora just stepped right in, and nothing has ever been an issue. If they have questions, they contact my doctor.
An exceptional human being.
They feel so comfortable just approaching him, and it feels like he's just, another person at the temple, right? It's not like, he's up here or something like that. They feel like they can just relate to him personally.